Okay, so let's start with the BodyTite. So we're on the Ignite device. We're going to talk about the BodyTite technology. And now we have the new turbos, which have a higher wattage, which means they're going to be quicker. And it will still support the classics. Okay, so BodyTite, FaceTite. This is the one I love to. This is the one I use in the office, not daily, but definitely weekly. As a surgeon, the majority of my time is spent operating, but I still do a lot of minimally invasive procedures throughout my week. So it's every week where I'm doing multiple BodyTites and FaceTites. I can do these awake in the office. In the office. Yes, in the office. I had a question, or I know that a question arose about, like, what about the sterility? What about doing this in a surgery center? It's just like any other office-based procedures. You want a semi-sterile field. It's no different than taking off a mold, doing a PAP, doing all the things that all of us do in our normal walks of professional life, right? So I'm just making a tiny 16-gauge stab or 2-millimeter punch. That's it. And betadine, chlorhexidine, sterile, semi-sterile space in a procedural space in your office. That's all you need. I own a surgery center, and I don't go to the surgery center. It's too expensive. It costs too much money to open that thing up. If we're going to the surgery center, we're operating. And then you get charged a surgery center fee, right? Even though I own it. So this I preferentially do in my office-based procedure room. So all I need is a little side room, office-based procedure space, where I can create a quasi-sterile field. And then I just make a little stab. You tumescent up with a local tumescent mixture, plus or minus some oral if they need for anxiety. We've got Pronox out here, great to chill a patient out. You can use Valium, whatever your mix is. I know all of you have a cool, fancy mix like MLK melts, and you get your compounding pharmacy to make cute little lollipops. I've seen it all, done it all, and I can tell you my specifics towards the end when we get to our procedural demo at the very end of the day on how we create good pain tolerance.